This podcast is brought to you by Al Jazeera.
The biggest battle of Barack Obama's first year, fixing a healthcare system in crisis, spiraling costs and tens of millions uninsured. But this broken system is also highly profitable. In the back rooms, a battle is raging as the powerful healthcare industry pushes for change that doesn't change the bottom line. Here in the richest country in the world, there are almost 50 million people with no health insurance. And there are a similar number who have insurance that doesn't actually take care of them when they get sick. This broken system is also the world's most expensive. The healthcare industry here is worth $800 billion a year. So the stakes are incredibly high as President Barack Obama tries to deliver on his campaign promise to reform healthcare. Here in the halls of Congress, industry players are lobbying furiously to protect their profits. Meanwhile, a grassroots movement calling for a nonprofit public system is trying to break into these rooms where decisions are made. On occasion, they are literally thrown out by force. On this edition of Fault Lines, the battle to transform healthcare in the United States. Truly a life and death struggle. Every 24 minutes, somebody in the United States dies because they don't have health insurance. Every 30 seconds, somebody files for bankruptcy in the aftermath of a serious health problem.
I ended up losing my job. I ended up losing my health, all my savings.
What are you getting done?
Having all of my teeth extracted. 19. I've called dentist and I don't have $3,500.
This is about every family, every business, and every taxpayer who continues to shoulder the burden of a problem that Washington has failed to solve for decades.
What's playing out right now in the United States is the first major test of the Obama presidency.
Which way am I going?
His push for healthcare reform and the push back from Republicans and even members of his own party has hurt his approval rating. For the first time since he took office, he looks vulnerable as criticism rains down from both right and left.
I want to see the day when healthcare is a right.
This bill must be stopped in any form.
We're going to have immediately higher taxes, even higher unemployment, and the stock market is going to take a tumble down.
But the healthcare debate is about much more than just Obama. It casts light, not just on how the system fails millions of people, but also on the very way the country works. It's a story of backroom deals, ruthless spin campaigns, an orgy of lobbying, and big, big money.
Everything that you would think of in healthcare as a service is in fact an industry, a sub-industry of the healthcare industry.
America spends $2.4 trillion a year for healthcare, all spending. 1 out of every $3, or $800 billion a year, goes for the activities of the for-profit health insurance system. That's what the fight is about. This is a fight over $800 billion annually.
Our story begins here. Dawn in the Smoky Mountains of East Tennessee. In one of the poorest counties in the state, an organization called Remote Area Medical has come to town offering free basic health care. Hundreds of people are ready to wait overnight.
Okay, may I have your attention, please?
Pay attention.
Yeah, good morning, everybody. Thank you very much for coming. This is an all-volunteer operation, including the members of the State Guard. So nothing to do with the government, and we're not going to ask any questions. All we need to know is that you're here. So, who's got number 1?
I do.
Okay, come on down. And show us your numbers, please. Number 2, number 3.
So how long have you been here, Melissa?
We got here yesterday about 7:30 in the evening.
So that would be about 13 hours then?
Yes. Been a long time.
Here at Cocke County High School, Stan Brock is overseeing his 574th medical expedition. 25 years ago, he founded Remote Area Medical, known everywhere as RAM.
14. When I stood out there this morning and were faced with 488 people out there, it was a scene identical to what we would find when we were in a place like Guatemala or Haiti. The same kind of desperate look on people's faces, the same type of medical conditions that we're seeing.
That hurt right there?
In the early years, RAM's temporary field hospitals only touched down in poor countries like Guyana and Nepal. Since the early 90s, though, 2/3 of its work has been right here in the United States.
Okay, you're done. You're done.
There are people that are in intense pain. We've got to take out all of their teeth. They're all rotten. People that can't read the big E on the eye chart in order to be able to function and get a job.
Until a few months ago, Della had a good job as an accountant at a demolition company.
Go ahead and blink real quick.
I have rheumatoid arthritis in my spine, and I was going to the doctor having 32 shots every 2 weeks. Now I'm having to do without that, and I have a lot of back trouble because of it.
So you can't afford to pay for it out of your
pocket? I can't afford, no, because...
So you just go without?
I have to do without. With all these insurance issues and, in America that's going on, people like me are we're having to rough it. We're having to do without. People are dying.
It's no surprise that stories like Della's are becoming more commonplace. The cost of health insurance has more than doubled in the last decade. A huge burden for families, but a boom for the insurance industry, where profits at the largest companies are up more than 400% in the last 8 years. It's not even noon, and already hundreds of teeth have been pulled and glasses fitted, while hundreds of patients are still waiting. Witnessing this kind of triage in the wealthiest nation on earth, it's hard not to be moved. It can certainly change your view of the healthcare debate. 500 miles from Tennessee, and we're on our way to Philadelphia to meet someone who first visited a RAM project just a few months ago. For this health insurance executive, it was literally a life-changing experience.
Hi there.
How are you?
Nice to meet you.
Good to meet you too.
I knew to a certain extent that this existed, but in my corporate office, I dealt mainly with numbers, and I really hadn't really thought about individual human beings and how they're affected by our dysfunctional system.
Wendell Potter was not just any insurance executive. He was the head of public relations for Cigna, one of the top 7 for-profit insurance companies in the U.S. Not long after his visit to RAM, he resigned.
And I realized that these people could have been people I grew up with or neighbors of my parents. And it just hit me like I was being hit with a 2x4.
Overnight, he became a leading critic of for-profit health insurance, the very industry that he served for 20 years.
They dump people who are sick, and that's how they make money. They make money by first of all, trying to exclude people who've had some history of illness. They call this pre-existing conditions. So they try to avoid paying claims of anyone who has had a history of any kind of illness. In California alone, I think the regulators ultimately found that about 20,000 policyholders their policies had been rescinded, and that enabled the companies to avoid paying $300 million in claims.
Predictably, Wendell Potter's former colleagues in the insurance industry are not eager to talk about his conversion. You're hearing from someone who's been a key player on one side of this battle, who is all of a sudden very, very powerfully arguing the other side. I just wonder how you see that from within the industry.
We're focused on what we can do to advance healthcare reform. Last summer, we went on a nationwide listening tour, and we heard directly from the American people what their healthcare concerns were. And we've been focused on...
Totally sweet story, but I'm asking about Wendell Potter, who is totally committed to a completely different vision of healthcare reform than what he was arguing for as head of corporate communications for one of the biggest companies in your industry group a year ago.
Well, I can't speak for somebody else and why their positions are and what they feel about reform. I can only speak for what our industry is doing and our strong commitment to reform. It's something that we've been working on for more than 3 years now.
But he says that you guys
that.
lie and twist numbers and deny people coverage and do everything to maximize the bottom line at the expense of people's health. And he says it as someone who was participating in it for more than 20 years. So is he lying?
We're proud of our record of providing quality services to people across the country, of what our industry has been doing over the last 3 years to develop workable, constructive policy proposals that are going to address the concerns we heard from the American people.
They keep saying they're coming to the table with solutions. They're not saying anything different this time than they did 15 years ago.
Are they coming to the table with solutions?
They're not coming to the table with any solutions that I want anything to do with. No.
That kind of cynicism, while rare in former insurance executives, is very common in the U.S. A recent poll found that only 9% of Americans trust health insurance companies to fix the system. In the outskirts of Washington, D.C., we paid a visit to Anna Gardner.
Hi there.
I'm Avi. Her experience with Cigna Insurance, Wendell Potter's former company, has put her firmly in the 91% group.
Okay, I was in commercial real estate for 20 years, and I was doing really well. And then I started getting sick. And what happened is I ended up getting sent from one test and doctor to the next. Each specialist found something wrong in another specialist field, and I just got lost through the cracks. This CT scan, this CT scan.
Anna has kept meticulous records of her journey through the system.
Barkin, Krantz, Farrar, Hare, Helmkamp.
She finally discovered that a bacterial infection was at the root of her complex problems. But by the time she knew what was wrong, she had lost everything.
So I cashed in all my retirement to continue to pay for this. But I felt like I was banging my head against the wall because nobody was doing anything. Well, I'm really not taking much in prescription medication.
Anna started with good health insurance, but lost it as a result of getting sick.
But this is not everything.
It's not? No. She and the insurance company have paid for tens of thousands of dollars of duplicated tests and procedures.
Health food store here.
Now that she's disabled and poor, she's finally receiving free medical care at government expense.
When I complained to Cigna and to the doctors, I was ignored. I sent a letter to Cigna. It was returned months later with a form letter.
Despite repeated requests, Cigna declined to speak to us for this story.
It's a for-profit Wall Street company, and they're there to make money for their shareholders, period. End of story. Wall Street has no heart. It's all about money, period. And they're doing their job.
Washington, D.C., in the midst of the first attempt in a generation to transform the broken $2.3 trillion U.S. healthcare system. The new president is staking his political capital on getting a bill through the torturous process of lawmaking in the USA, a labyrinth of committees, subcommittees, and party factions in both the Senate and the House of Representatives. And at every turn in the hallways of power, there are forces pushing to shape legislation to their own advantage. Lobbyists. At this pivotal moment for change in the U.S., for-profit healthcare industries are spending $1.4 million on lobbying every single day.
They are the doctors, for-profit hospitals, insurance industry, drug companies, medical device companies, for-profit clinics, specialty operations, surgery, old age homes, every single medical specialty. You have a government that is essentially manipulated and in some cases bought and paid for by what are, in the U.S. context, called special interests. And when it comes to healthcare, when you're talking about 18% of the economy, these are very powerful special interests.
The last major attempt to fix U.S. healthcare was in 1993, when Bill Clinton's legislation died on the operating table, victim of massive attacks from the healthcare industry. But since then, healthcare costs for families have spiraled, even as insurance companies have seen windfall profits. almost 50 million Americans are now uninsured. This time around, the industry knows that the momentum for change can't be fought head-on.
We want fundamental reform.
And we're putting all of our resources behind advancing reform.
Supporting bipartisan reforms that Congress can build on.
While industry players celebrate reform in the abstract, they're much less enthusiastic about any specific change that would threaten their bottom line. The two big goals of healthcare reform are to provide health insurance to millions now uninsured and to bring down the spiraling costs of the healthcare system. One of the key proposals to meet both goals is the so-called public option, a government-run insurance plan to compete with private insurers and keep them honest.
Back to me a touch, good, right there.
James Rohack is the new president of the American Medical Association. The AMA has endorsed a bill with the public option in it, but it's almost impossible to get him to admit that. Do you support the public part of this health reform bill, the public insurance?
Well, again, as we mentioned, we support H.R. 3200 as the first step to move forward.
So you want to strip out the public option?
We support moving forward on health system reform. Number one is that it doesn't force patients to go in it. It also says to the physicians, you don't have to participate in that plan if you don't want to.
So what you like about the public option in this bill is that people don't have to use it?
It preserves choice.
The cost of expanding healthcare, at least $1 trillion in the next decade, has given opponents of reform easy ammunition. So Obama has put a major precondition on the bill. It must contain measures to pay for itself.
It's a plan that will not add to our deficit over the next decade.
When the war started, the war which I opposed, no one asked, how are you going to pay for it? When the Wall Street bailouts came, which have now numbered in the trillions, no one asked, how are you going to pay for it? But as soon as you start saying you want health care for people, people say, wait a minute, how are we going to pay for this?
Still, the banner of fiscal restraint has been seized by members of Obama's own party, who have been slowing down the legislation, demanding that the price of the bill come down.
Well, I am a member of the Blue Dogs, which are the fiscal conservative Democrats in the House of Representatives.
Its concern for costs has netted the coalition of 51 Democrats a lot of cash. The Blue Dog Political Action Committee has collected a record-breaking $1.1 million so far this year, with the health sector its leading donor. So for the Blue Dogs, this obstruction has been very profitable. So aren't you guys just slowing the process down on behalf of the big donors? Because that's what it looks like from if you follow the money.
Well, if you follow the money, you'll see that I haven't seen any of that money. So,
well, according to the Center for Responsive Politics, you've got a $407,939 from the health sector in your career.
$400,000 from the health sector?
Yeah.
No, that's impossible. Totally and completely impossible.
In your career as a congresswoman.
Well, that
according
would be,
to the Center
that would
for
be over
Responsive
7
Politics.
elections.
Right.
So 7 into 40 would be 60,000 an election. First of all, that's not a lot, but I believe there's a lot of money flowing. I just would assume that it would flow to those people who have more direct control of the bills, who have an ability to amend those bills.
The American people have a right to understand what the cost and consequences are of a government takeover of our healthcare system.
Across the aisle, Republicans and their conservative allies in the media have been even less subtle in their attacks on reform.
That plan, my friend, is not only socialist, it's probably inconceivable how bad that would be for the United States.
When he says public option, that means putting government bureaucrats in charge.
They raise the specter of a government bureaucrat between, calling the shots, when in fact what we have in this country now are corporate bureaucrats calling the shots and making those kinds of decisions. And I don't think people realize that those people who are calling the shots now are motivated by Wall Street.
In fact, the worst-case scenario for healthcare reform is that it will end up like the bank bailouts, with the very same players who created the crisis walking away with the cash.
Well, we had a big economic crisis, as you're aware, last fall, and many of those companies lost a lot of money. So the insurance companies need a bailout, just like the other financial institutions need a bailout, and that's why they are so on board, because, no surprise, they're saying, We're all for health reform as long as you mandate that everybody purchase our product and you give them government dollars to help them do that.
So they better start shaking a leg. They better start putting a people's platform forward that has at its core the need for single-payer, Medicare for all, improved national health care. Thank you. Keep the faith.
What seems remarkable about this whole debate is that the one system of healthcare most likely to bring down costs and provide coverage for everyone isn't even on the table.
What do you want? What do you want?
In the US, they call it single payer. It's the type of universal healthcare provided in Canada and France, funded by the government and provided mostly free of charge to all. It's a system that President Obama himself has said makes most sense, but it is treated by elites here as politically impossible.
Under a national health program, if we create a national Medicare for all system, the way it works is that for each person, you're paying into that system throughout your life, and then when you need it, it's there for you.
That single-payer health care is the only solution to the health crisis in America.
Its passionate advocates have been struggling to make their voices heard, shut out of the debate, even arrested trying to speak in Senate hearings.
The moral issue is that health care is a right and not a commodity in which people, insurance companies, and drug companies should be making billions of dollars in profits.
Single payer, for example, has millions and millions of supporters. You would think at least they would have a serious place at the table.
It's cost neutral. A single payer system is cost neutral. But for whatever reason, that's been taken off the table because you have an 800-pound health insurance gorilla sitting on the table.
Various versions of a healthcare reform bill continue to make their roundabout way through Congress, past committees, subcommittees, and back rooms. Industries continue to pour money into shaping the legislation and protecting their profits. Those most desperate for change have no voice in this process. It's looking likely that some kind of healthcare reform will pass in the next legislative session. It's looking a whole lot less likely that it will bring about fundamental change.
You know, we see an improvement for a year or two, and then it fails due to cost, and we're back with higher number of people who can't get health care.
We'll provide affordable health care to tens of millions of Americans. That's a big deal. But at the end of the day, if you're asking me, are we moving forward in a rational, cost-effective way to understand why costs are so high and outcomes are so bad? No, not really.
Every other advanced industrial country in the world got universal health insurance in the wake of World War II within 1 or 2 years. 1946, 47, 48. We are literally 60 years behind the times.
Back in Newport, Tennessee, the Remote Area Medical Project is dealing with health conditions that really look decades behind the times. For the time being, for millions of Americans, this will continue to be the reality for those who are too poor to get sick.